Hello, everyone. Thank you so much for joining me today. My name is Justin Kramer, and today we're going to be going over Medicare basics. Again, thank you so much. I know there's a lot of other things you could be watching, but you chose to watch mine, so that means a lot. So, for today's webinar, it'll be handy for you to have a pen and paper for notes and any questions you'd like answered. You can give me a call and we can answer them later, or you can shoot me an email also. So I'm Midwest Health and Life, Justin Kramer. We're not going to go in about a little bit about me, but if you're in the area and you'd like to come to one of my seminars, definitely reach out to me and I would love to have you. So our goal for this seminar is we're going to go over what Medicare is, what Medicare covers, and what it doesn't cover, and how you can cover what Medicare doesn't cover. So my goal for you is to present this information where you can make an informed decision about what your options are. So I know a lot of you guys have been receiving nonstop calls. It's just very important who you talk to. So keep that in mind. It's always good to talk to someone that is very knowledgeable in these areas. So, what are the events where you can get Medicare? If you're turning 65, that's the most common one. If you have an end stage renal disease or Lou Gehrig's disease, that's another one. If you're going on disability for 2 years or more, or if you delayed your work coverage and now you're ready to go on to Medicare after the age of 65. So, enrolling in Medicare, if you are enrolled in Social Security automatically, your benefits will actually begin automatically and there's nothing you need to do. But if you're not enrolled in Social Security, you will have to go to ssa.gov. And again, this is someone that can help you with this along the way. So someone can help you enroll. You can go to ssa.gov or you can call the Social Security number. What is your initial enrollment period in Medicare? So it's a 7-month window. You have 3 months before the month of your birthday, the month of your birthday, and 3 months after your birthday. So when will your Medicare begin? If your birthday starts on the first of a month, so let's say for instance your birthday is July 1st, your Medicare will actually begin the month before, so it would start June 1st. Now if your birthday is July 2nd through the 31st, your Medicare will actually start on July 1st. So that's important to know when your Medicare will start. So if you have retiree health coverage and you're no longer actively working, you could have a Part B penalty. So it's important to know what you're getting into before it happens. That Part B penalty is 10% for every 12 months you go without Medicare. So again, this is where it's important to talk to someone about your Medicare decisions, your health decisions, and just go over your options with someone. So if you're working and you have group coverage and it's credible and you're going to delay Medicare, things to consider. Which one will be better for you? Premiums, deductibles, copays, coinsurance. There's a lot of factors to figure in. Sometimes Medicare can be better, and other times it makes sense to stay with your work coverage. So it's important to review your options and make sure you know kind of what would be better for you. Coverage options for spouse not on Medicare. So if you're working but your spouse isn't on Medicare, there are options out there for you. Sometimes the options aren't good and sometimes the options are amazing. So again, this is where it's just important to review your scenario with someone like me who can help you with these decisions. So let's talk about Original Medicare and what it is. Original Medicare consists of two parts, Part A and Part B. Part A you can think of as your hospital stay. So for most people, Part A will be free, but if haven't worked 40 quarters or 10 years worth of paying in, you're going to have to pay for it. So that amount is on the screen if that falls for you. And Part B, so let's scoot back. So Part A covers your hospital stay. So just think of your room and board when you think of Part A. When you go to the hospital, there's a $17.36 deductible every time you go in, and that pays for the first 60 days. So let's say, for instance, you have to go to the hospital, you're there 5 days. You have a 1736 deductible, and then after that, days 1 through 60 are covered for your room and board, let's say. Now, let's say a week later you go back into the hospital and it's for something totally different. That resets and you're going to have that 1736 deductible. So for Part B, most people will pay 202.90, but this is determined based on your income. So there's a one-time deductible of 283, and then after that it becomes an 80/20 plan. So with 80/20 being said, if you have a $100,000 bill, you're going to be responsible for $20,000 of that. And then you have that one time a year deductible for 283, and that's for 2026. So normally every year it goes up just a little bit. So here's if you make more than $109,000 and you're single, or $218,000 if you're married, your premium more than likely is going to be a little higher. Now keep in mind this is based on the previous 2 years modified adjusted gross income. So for 2026, it's based off what you filed for taxes in 2024. So if you are single and your monthly income limit is less than $2,200, there's programs out there to help you qualify. You need to have less than $10,000 for the Medicare Savings Program. And then also, if you're married and you're making less than $3,000, I say it's good to get with someone like me and we can review your scenario and see what programs you could potentially qualify for. So your Medicare Part B premium, if you're on Social Security, your Part B premium will come out automatically from your Social Security check. Again, you'll be automatically enrolled. If you're not on Social Security, you will receive a quarterly 3-month premium notice for your Medicare bill, which can be very expensive. You can go online at www.mymedicare.gov and you can change that to every month. And you can also call in to change that. It's a very easy process. So the exposures of just original Medicare, you have that Part A deductible of $1736, and for Part B, you have that coinsurance. It's an 80/20 plan, and then you have a 15% excess charge that could be charged. It's not always charged though. So let's go over how we cover these exposures. So there are two options on how to cover in these. You can keep your original Medicare, and then you can add a Medigap plan, also known as a Medicare supplement, and then you can add a prescription drug plan, or you can go the Medicare Advantage route. So we're going to jump into both these here soon. So a Medicare supplement, you do pay an additional monthly premium, but it covers that 80/20 gap. So that 20% you're responsible for, the Medigap would actually pay for that. Shut this down. It's getting warm here in Iowa. So one thing people love about staying on original Medicare and getting a supplement is you can go to any hospital, any doctor in the United States that accepts Medicare without being referred. So we're going to talk specifically about the Plan G today. There is a Plan N that's about $20 cheaper, but for the most common one people get these days is Plan G. So I'm going to take you guys actually to Medicare.gov, and I'm going to show you how you can see what your supplement rates are. Keep in mind that this isn't always 100% up to date. Medicare.gov is your go-to for everything, is what I tell people. But for the supplement rates, they can be sometimes behind. So we're going to go in and we're going to type in Fort Dodge, Iowa zip code. Oh. And so now we are specifically looking at Medicare, Medigap policies, so Medicare supplement. So you're going to come down here and click this. And then we are a 65-year-old female that does not smoke, and we're going to say she gets the spouse discount. So we're going to update prices on that. We're going to scroll down here, go to Medicare Plan G. So you're going to see here the only thing not covered is the Part B deductible here. And so we're going to hit view policies, and this is going to give us the price for a 65-year-old female that doesn't use tobacco. And so I'm not going to jump into this, but if you need help, I can help show you what company would be good. Things you're going to want to keep in mind of is the company losing money? Because if they are, more than likely their rates will increase. And there's other factors to keep in mind. The rating of the company. So that's what it's good to have an agent to go over one-on-one which one could be best for you. But do keep in mind that all Medicare supplement Plan Gs are federally regulated, and they all do the same thing. So a Plan G with one company is a Plan G with another company, and they're all the same. They all do the same thing. So the only thing difference, the rates, and then just keep in mind it's important to research to know if that plan will go up, because more than likely every year these will go up a certain percentage. So I'm going to scroll through this really quick. You're going to see the cheapest one on here is $110. There's 38 different policies, and I'm going to go through this really quick just so you get an idea. And it goes all the way up to $496. So it's very important to keep in mind. Get with someone who can research this and show you all your options on this and tell you the ins and out on that. So that's what I had for that. We're going to jump out of that real quick. But again, you go to Medicare.gov. You type that in, and if you need, just go back, rewind, or give someone like me a call, and I can help show you your options. So Medicare Supplement Plan G, it removes that Part A $1,736 deductible you have. And then it covers your Part B coinsurance rate and that excess charge they could charge. So you are responsible for the one-time deductible. For 2026, it's $283. So now let's talk about Part D prescription coverage. So if you have lower tier medications, more than likely this is going to be great for you. If you have higher tier medications, it could cost you. And this is a number one expense for Medicare beneficiaries. Annual enrollment period every year is October 15th through December 7th. So it's very important to check your formulary every time that year because it could change. So your price could go up on your prescription drugs. And so what I ask people to do is let me know if there's any doctor changes, any prescription changes, pharmacy changes. And I'm going to walk through this on Medicare.gov also. So we're going to do this really quickly. And again, I have a separate video on this. So we went to the health and drug plans. So let's go back here. And we are actually going to look at, we looked at Medicare supplements. And now we're going to look at Medicare drug plan. And again, I'm going to be really quick. These are the extra programs that I was talking about you could get help from. For now, we're just going to put I don't get help with these programs. Do you want to see cost when comparing? For now, we're going to hit no, because I'm going to go over that in the slides next to it. And so you're going to see for Webster County, Iowa, the cheapest one is $4.70 a month. They do come with a $615 deductible. Keep in mind, for tier 1 and 2, that normally doesn't apply. So that's your higher tiers, what the deductibles are for. A lot of people have the WellCare one, $9.60 this month. Again, this depends on your scenario, though. If you take a lot of medications, it's very important to review this. So that's how you do that. And we're going to jump back into here now. So let's say you take amlodipine, hydrochlorothiazide, lisinopril, and metformin, and you go to a preferred in-network location. This plan is going to cost you $0. So here we go. Here, and let me just show you that right here while we got it pulled up. So we're going to hit, we do want to see drug cost, and we're going to say amlodipine. We're just going to add the most basic one. And this is also how, if you wanted to research, this would be how you do it. Let's say metformin. And we're just going to do a basic one of that. And then let's do one that I know is very expensive. So Repatha. So you'll be able to see kind of, and I'm just going to remove this one here. So we're going to do a common one. and then we're going to do a higher tier one. So done adding drugs. It's important. So I always recommend add multiple pharmacies here. So we're going to add CVS, Walgreens, IV, and I'm going to take this one off, and we're actually going to add Walmart in here. So you're going to see the difference in how important it is. So the Repatha, this is going to be the cheapest Medicare.gov is showing me. This is the Humana plan, which is $103 a month. I personally don't have anyone on that plan, but depending on your scenario, you might. Most people I help, but let's just look at this one right here, $103 a month. Again, this is the highest one that I've seen, but it could come in handy. So you're going to go down here, and you're going to see amlodipine for a yearly cost at Daniel Pharmacy is $13.92. Walmart and mail order will cost you nothing. So it's important to know what pharmacies to go for. So Repatha, so before mail order was $3, so it's still decently cheap with this one. They're $3.75 and $0. So mail order could be the route to go, and actually Walmart would be a little bit cheaper. So it's important just to know kind of what pharmacy to choose from on here. Again, this is something where your scenario, I would love to walk you through this and just see what plan would be best for you on that. If you don't get a Part D plan, there is a 1% penalty for each month you do not have credible coverage with this. This is a permanent penalty that will not go away. So this is very important. I'm going to skip this part. There are saving options out there for some scenarios on that higher tier medication if this is an issue. So we're going to go ahead and do some math. So for this basic one, we're going to say your original Medicare is going to cost you $202.90 a month. Remember, it could be more if you make a little more, but most people will pay $202.90 a month. Your Medigap, we're going to say, is $115, and we put you on a $25 prescription drug plan. So that equals $342.90 a month, $4,114.80 a year. Plus, you have that $283 deductible. So your medical plan will cost you $4,397.80. And this isn't including any prescriptions you're taking. So if you take some high-tier medications, that's not on top of this. But this would take care of this. You essentially don't have bills when you go in there. I shouldn't have said you don't have bills. So let me redo this slide right here. So now let's do some basic Medicare math. Original Medicare for most people will cost you $202.90. I'm going to restart this whole thing, actually.